Welcome to the 30th Annual MFA Conference. Thank you for taking the time to be with us this afternoon. My name is Natalie Williams. I am the current president of the American Kinesiotherapy Association. I work at the Tampa VA. I have been a kinesiotherapist for 12 years. In addition to my kinesiotherapy certification, I am also a certified aquatic therapist. Today, my presentation is KT, the Whole Health Specialist. Disclaimer: this presentation is for educational and informational purposes to present a general overview of the kinesiotherapy profession. The thoughts and opinions expressed during this presentation are solely those of the presenter and not necessarily the thoughts of the American Kinesiotherapy Association. So the objectives today are to introduce the KT profession, the origins and the value to the healthcare continuum. 2, to describe what makes KT unique from other allied health professions. 3, define the whole health specialist. And 4, describe the benefits of having a staff kinesiotherapist and the unique patient populations that can be added to the facility demographics. First, we have to define kinesiotherapy. Kinesiotherapy is defined as the application of scientifically based exercise principles adapted to enhance the strength, endurance, and mobility of individuals with functional limitations or those requiring extended physical conditioning. So a little bit of the history of kinesiotherapy. Kinesiotherapy, formerly corrective therapy, is an allied health profession that has been in existence since 1946. The roots of this profession began during World War II with the increased survival of troops suffering from illness or injury. There was a great demand to return soldiers to active duty. Corrective physical reconditioning units were established to enhance this process. The name corrective therapy was formally changed to kinesiotherapy in 1987, and the national organization became known as the American Kinesiotherapy Association. In the continuing efforts to meet and maintain the highest standards of rehabilitation, kinesiotherapy formally recognized as an allied health profession by a national accrediting body, the Commission on Accreditation of Allied Health Education Programs, also known as KHEP, in April of 1995. Kinesiotherapists are highly trained healthcare professionals. Our entry-level education requirements include a bachelor's degree in kinesiotherapy or exercise science with an emphasis in kinesiotherapy. This education must include a clinical practice in a VA-approved training program or the equivalent. Kinesiotherapy promotes an environment for clinical education. There is an average of about 60 KT students participating in clinical internships across the veteran system each year. As you can see, we have some very awesome educational backgrounds with exercise physiology, psychology, biomechanics, and we also are required to have over 1,000 clinical internship hours before graduation. The structure of kinesiotherapy. The AKTA, the American Kinesiotherapy Association's mission is to support the rehabilitative services of registered kinesiotherapists while promoting the health and wellness of all populations, including veterans and individuals with functional limitations. COPS-KT, or the Council on Professional Standards for Kinesiotherapy, maintains the standards for education, credentialing, and professional competencies for the KT profession. VA-FAC, VA Field Advisory Committee, supports and provides counsel on issues that affect the KTs in the VA system. As the president of the Kinesiotherapy Association and our executive team, we would like to focus on the following 4 initiatives for year 2021. We want to focus on whole health and health coaching, rural health, which includes cardiac rehab and minority care, COVID-19 recovery, and pain reduction. KTs are trained to quickly and efficiently rehab an individual from behavioral modifications to diet and exercise to lifestyle changes. As a transitional rehab specialist, KTs serve as a bridge between acute illness and physical wellness. KTs help to reduce the cost by evaluating the workplace for injury prevention, employee wellness, and evaluate during functional capacity exams. KTs' advanced training and comprehensive knowledge and telehealth services can help to expand membership services. Similar yet different. KT is often become synonymous with KT. There are several similarities, but yet there are differences. Kinesiotherapy applies exercise principles to help patients improve their mobility, strength, and endurance, while physical therapy involves exercise and other techniques such as ultrasound and the use of medical instruments. Exercise physiology focuses on the human response and adaptation to exercise for health promotion. Athletic trainers specialize in the management, prevention, and recovery of injured athletes. The KT Foundation. Kinesiotherapists utilize 2 fundamental modalities, exercise and education, to enhance and regain function through improved mobility, strength, endurance, and flexibility. A kinesiotherapist is the bridge between acute illness and physical wellness. Effective KT treatments often begin when traditional therapy ceases. The KT approach to exercise could be defined as structural and functional integration. In essence, the treatment approach is not limited to a segmented body area, but the treatment approach to the impaired body structure is restored in a holistic manner. Improvement through movement begins in the mind, with intention, with goals, with hope. This is a quote that was quoted to me by our very own Executive Director, Kathy Camp. Every single individual at one time in their lives struggles with weight. A body transformation begins in the mind. A large percentage of veterans have had a brush with depression, especially when dealing with a life-altering injury. Rehabilitation, successful rehabilitation, begins in the mind. The social media catchphrase for this decade is self-care. What does that mean? It means creating a body-mind connection for whole health. KTs have been studying and implementing whole health and wellness since 1941. KT, the whole health specialist. KTs are uniquely equipped with an extensive knowledge of health education, therapeutic exercise, and behavior change to treat the whole person in each of the components of wellness. KT use some of the following tools to evaluate and treat their clients. KTs use education, exercise, personal health inventories, healthy living assessments, SMART goals, and motivational interviewing. The kinesiotherapist will empower and equip patients for overall wellness and lifestyle change through guided expertise as both a therapist and a certified health coach. The kinesiotherapist will help the patient take control of the behaviors that have held them back from losing weight, eating healthy, engaging in physical activity, and achieving whole health. The knowledge of motivational interviewing, positive psychology, and effective goal setting will create potential patient success and self-efficacy. The 6 components of health include mental health, emotional health, environmental health, social health, spiritual health, and physical health. First, we will start with mental health. Mental health is the well-being of an individual encompasses many aspects. Realization of one's abilities, coping with normal stresses of life, productive work, and contribution to one's community. As a kinesiotherapist, we often find ourselves evaluating more than just the physical body. Oftentimes during our evaluations, we find that a patient may be dealing with some cognitive deficits. Some have substance abuse, adjustment disorders, are participating in some form of psychiatric care. In our Veterans Administration, we deal with veterans that have PTSD and often mood disorders. Here are some of the approaches that we use to address a client's mental health. We use Tai Chi, yoga, and therapeutic exercise, just to name a few. Our assessments and education include goal setting, the PHI, the personal health inventory, the health and living assessment, and a personal health plan. The next component of health is emotional health. Emotional health is the ability to express and cope with one's emotions in a positive non-destructive manner. During our assessments, we also have patients that have a flat affect and will nod and just give you the answers that they think you want to hear. We evaluate them to discover what are their support systems. Do they have family? Do they have friends? Do they have a community of people that will work with them as they journey to better health? Disease process. Oftentimes we educate the family and the veteran on the disease process. We teach them, we educate them on what to expect, what are the signs and symptoms of the disease that they have been diagnosed with. We also do assessments for awareness. Oftentimes we find that our clients are not aware of some of their limitations. So that goes back to the mental health when we have to address the cognitive deficits. Again, some of the exercise techniques that we use are Tai Chi, yoga, different types of therapeutic exercise. Our assessments and education include coping skills, problem-solving skills, behavioral management, addressing the enhancers and barriers to learning, task planning, supporting goal-directed behavior, and addressing their lifestyle and their support system. The environmental health refers to all aspects of the natural and built environment that may affect human health. As a kinesiotherapist, we address environmental health with the veterans or the patients' common areas. Some of our veterans live in rural areas and find difficulty getting to the KT clinics and facilities. We have veterans that we evaluate their homes. They may live in ALFs or assisted living facilities or senior nursing facilities. So all of those things we have to evaluate and bring awareness to. Some of the approaches that we use for environmental health. As a KT, we often go out to homes and design a home exercise program for those patients. We see those patients in an outpatient setting. Assessment and education. We often go to the homes to do home safety evaluations. We address stairs if the patient is having difficulty walking. We address the height of the cupboards, the height of the sinks, the counters, ramp access to the home, access to the pool. We also use telehealth services, which have been an amazing source of communication for us in this time. We evaluate and develop a plan with the patient and his family for emergency disaster preparations, community reintegration, family and caregiver training, fall prevention. Social health. Social health refers to the dimension and individual well-being that concerns how one gets along with other people, how other people react to the individual, and how one interacts with social institutions. As a kinesiotherapy, we encourage our patients to have positive relationships, to employ great communication skills, and to promote positive self-esteem. To address our social health, KTs use therapeutic exercise, group exercise, wheelchair games training, and interdisciplinary group activities. Assessments in education include social interaction, appropriateness of behavior, and we also use the PHI and the HLA. Spiritual health. Spiritual health refers to living life according to one's ethics, morals, and values. It also refers to finding strength in difficult times. As a KT, we often use the PHI and HLA as a general overview of each of the 6 components of health. During the spiritual assessment, there are questions that ask the patient about their life's purpose. Do they have a purpose for their life? Do they know the purpose for which they live? It asks about religion and any community activities and organizations as well. Some of the approaches and exercise that we use are therapeutic exercise, Tai Chi, yoga, and mindfulness. As mentioned, we also use the professional health inventory, the PHI, and the healthy living assessments in HLA. Physical health refers to the way in which your body functions overall. Kinesiotherapists are qualified to implement exercise programs and provide education, training designed to reverse or minimize debilitation, enhance the functional capacity regarding exercise techniques for weight loss, living a healthy lifestyle, and functional strength training to prevent injury. Some of the things that we address in kinesiotherapy are patient debilitation, functionality, and weight management. Some of our approaches include functional training. Functional training with mobility devices as far as crutches, canes, braces, walkers, wheelchairs, therapeutic exercise, aerobic fitness, aquatic exercise, and adaptive exercise for those who have suffered a stroke or of spinal cord injury. Our assessments and education includes a posture assessment, assistive or adaptive technology, if applicable, pain, dietary recommendations, and workplace modifications, if applicable. You ought not to attempt to cure the eyes without the head, or the head without the body. So neither ought you attempt to cure the body without the soul. For the part can never be well unless the whole is well. That is a great quote by Plato. The KT's effective treatment approach begins with the patient-centered care. This approach allows the patient to effectively manage and be more informed of the process, goal, and service of his or her care providers, which improves the patient's involvement and commitment to implementing physical, psychosocial, and behavioral health changes. Now that we've discussed some of the 6 components of health, I would like to talk to you about some of the advanced trainings that KTs may have. Many KTs have advanced skills, certification, and training in specialty areas. Some of those include aquatics, cardiac rehabilitation, functional capacity evaluation, geriatrics, health coaching, orthopedics, senior fitness specialist, weight management, and personal training. Kinesiotherapists provide a full scope of services. Treatment settings include veterans hospitals and clinics, private and public hospitals, fitness centers, private clinics, employee health services, health and wellness centers, colleges and universities, educators. Also, KTs provide consulting services. The Global Wellness Institute is recognized as a leading source for authoritative wellness industry research. The global wellness economy is currently valued at $4.5 trillion from their 2018 data. A kinesiotherapist is a transitional rehab specialist who serves as the bridge between acute illness and physical wellness. KTs are trained to quickly and efficiently rehab an individual from behavior modifications to diet and exercise to lifestyle changes. Some of the benefits of hiring a KT. According to the Global Wellness Workplace Wellness, according to the Global Wellness, workplace wellness is valued at $48 billion. And workplace wellness is projected to grow to $66 billion in 2020. In 2017, healthy eating, nutrition, and weight loss was estimated at $702 billion. Fitness and mind-body connection was valued at $595 billion. I said all that to say KT can help. KTs can provide consulting services for new fitness facilities to optimize accessibility. KTs can develop employee wellness programs to reduce the cost of work-related injuries. KTs can provide services to increase client programming through psychological and physical support. KTs are knowledgeable clinicians focused on improving the whole body. If you have questions about anything that was discussed in this presentation, please send me an email at akta.president@gmail.com, or you can contact the American Kinesiotherapy Association at info@kt.org, or visit our website at www.akta.org. I would like to thank you for taking the time to participate in this webinar today. I hope you found the information informative. I would love to hear from you. Please contact me at akta.president@gmail.com. Thank you.